Hello, everyone. I am Jacintha Nwoko, a passionate doctor of nursing practice student at Maryville University. It is with great excitement that I present my final DNP project to you today. My topic is to reduce the number of no-shows for psychiatry appointments among adults in a comprehensive community mental health center. My committee members are Dr. Melanie Parks, Dr. Snell, and Washington Gandhi. Background/significance. While this project aims to reduce unattended visits by applying a one-week phone call reminder for patients with appointments, no-shows cause significant scheduling issues for the clinic staff when appointment slots remain open. Patients will likely miss their appointment if they are not reminded through phone calls. No-shows lead to resource underutilization that affects the overall quality of healthcare delivery. Missed appointments result in hospital revenue loss, poor patient health outcome, underutilization of healthcare resources, and reduced overall patient satisfaction. Addressing no-show will lead to patient accountability by confirming rescheduling or canceling appointments while allowing hospitals to plan adequately. Review of the literature. What has been done on this topic? Missed appointments pose a significant problem that affects several aspects of mental health services and patients in many healthcare settings. It leads to other patients without appointments needing to wait for longer to receive treatments. The main consequences of such a delay in treatment include worsening symptoms, higher chances of hospitalization, and higher healthcare costs. Forgetfulness is the main reason why patients miss appointments. Urgent family matters, early slots, hospitalizations, and wrong perception of the dates contributes to no-shows. Theoretical framework. What is known? The Health Belief Model, or HBM, was developed by social psychologists Hirschbaum, Rosenstock, and Kegels in the 1950s to explain help-seeking behavior and decision-making. The framework elements like perceived susceptibility, severity, benefits, barriers, and cue to action affect overall health outcomes. HBM was likely key in these studies as it allowed the patient to reflect on its key elements, which are major determinants of the behavior shown towards receiving healthcare services. Method/design. How and what plans? This project adopted a quantitative research design to gather and analyze pre- and post one-week phone call reminder appointments, compliance rates, response to the attendance of the psychiatric appointment was the dependent variable, while the one-week phone call reminder system was the independent variable. Descriptive statistics was used to describe quantitative data collected before and after the intervention, specifically percentages for no-show rates, and inferential statistics such as chi-square test and z-test for proportion, evaluating the effects of the change. The design answers the research questions of whether the 1 week reminder reduces the no-show rate, fulfilling this project's expected goal. Sample. What data is needed? Adult patients who had an appointment for psychiatric follow-up in the facility were sampled for the study. Power analysis was used to calculate the sample size, which was 198 to a power of 0.80. The inclusion criteria for this DMP project are that the patient must be a patient at the community health center, be 18 years and older, be of all genders, and possess electronic working phone for receiving calls. An appointment scheduled during the 8-week intervention period between September 2024 and November 2024 was also a requisite, though the patient must have consented to the appointment reminder. This briefly explains how the data was collected. Data analysis. What choice of analysis? IBM SPSS statistics software was selected because it is one of the most trustworthy and commonly used programs for quantitative analysis. Independently of hierarchy, descriptive data frequencies and percentages were used to quantify attendance and demographic details. Z-test for two proportion to analyze the differences in categorical data were used to compare the no-show rates between the baseline and the post-intervention periods. The main goal was to better position to point out some factors that can help increase attendance. Why this choice? Results. What did results show? The primary outcome assessed was the difference in no-show rates during the pre- and the post-intervention periods. The results indicated that the pre-intervention no-show rate was 2.77%, while the post-intervention rate was 10.83%. Therefore, the null hypothesis was not rejected. The increase in no-show rate during the post-intervention means that the result was contrary to expectations. However, there was a level of accountability as more patients opted to reschedule or cancel their appointments, thus allowing the healthcare facility to admit more patients. The pictograph on this slide explains part of the results. How was it understood that the results show level of confidence needed? Limitations. What limitations? The selection bias was a key limitation in leading to the underrepresentation of patients. Demographics. The study participants were picked based on the position of an electronic working phone ready to receive appointment notifications, which led to an overrepresentation of patients with such traits, thus possibly skewing data towards compliance. The study also experienced measurement limitations because it relied on call logs and reported confirmation, which could have been an underrepresentation of patient behavior or intent towards honoring appointments. The selection bias limitation was addressed by the demographic characteristics of the sampled participants. The limitation on measurement was not addressed because other factors contributing to the no-show were not part of the study. Thus, further studies need to be adjusted. Discussions. What did we learn? There were expectations that a once-weekly telephone reminder would reduce the no-show rate. However, the results contradicted the expectations as the no-show rate increased after the intervention. Socio-economical factors might have influenced the result because patients often experience pressure from work, family, or societal settings. Patient-related ethical concerns might also have affected the results. Future research should approach the issue of confidentiality, especially when dealing with mental health patients. How did it address the subject? Who will benefit? Implication for practice. How does it affect the healthcare system? A one-week telephone reminder can be a foundation in attempting to zero in on a course of no-shows, which will help improve quality of services in healthcare facilities. A foundation approach will be an ideal benchmark in understanding facilities, challenges, and patient-related concerns, allowing the proposed intervention to have enough support to lead better results. The study will also imply improving health policies. Access to social support has had a remarkable improvement in patient access to healthcare services as their participation level increases. Conclusion. What did we learn? Patients' level of accountability improved, despite the study not reducing the no-show rate as expected. More patients were able to reschedule or cancel their appointments, something that changed during the intervention's implementations. DNP was instrumental in achieving this outcome through conducting scientific research, which incorporated all the process of conducting a scientific study. As a result, I gained experience in how the healthcare system works, the strategies used in patient engagement, and the complexities involved in addressing patients' issues and concerns. Questions to the audience. Based on what we have discussed, which one change you would consider implementing to tackle the issue of no-shows? Next, what strategies have you found effective in reducing no-show rates in your own practice? Do you think reminder systems alone are enough to reduce no-shows, or should we be looking at deeper causes? Invitation for questions. For any more questions you may have, please reach out to me to my Maryville email address provided on the slide. I have also included the references used for these projects as it stands, showcasing the research and insights that shaped our work. Thank you for dedicating your time and attention. Your involvement means a lot to me. Thank you for listening, and this concludes my presentation.